Very much for having me. Thank you to the whole Revive team for putting this together, and thank you for all for joining me this evening on discussing a topic that is really near and dear to my heart, discussing PRP and other aspects of regenerative medicine. So with that, I'm sure you all have things to do and lots of questions, so let's go ahead and get started. As Kim mentioned, I am a dermatologist at the Cleveland Clinic. I was fortunate enough to do an ASDS fellowship in cosmetic surgery and lasers, and I do currently practice aesthetic medicine in addition to doing a lot of hair loss and PRP. Here are my disclosures here. And with that, this is an outline of what we're going to be covering tonight. I think it's really important as we discuss PRP, we discuss other things, that are a part of this regenerative medicine, including what the definitions of like allogenic and autologous products actually mean. We're going to talk about the difference of like FDA clearance, the different PRP devices, and then, give you guys some tips on marketing claims. There is a new Google ad policy that does pertain to PRP, some things to take into consideration, and then, some actions moving forward and some takeaway points. So just a little bit of background about the FDA and physicians, and some of you may know this, but the FDA does not regulate the practice of medicine, but they do regulate the companies that commercialize and distribute these medical devices and drugs. So that it's important to consider these legal, safety, and ethical issues that you have to understand if you choose either knowingly or unknowingly to use any unapproved drugs and devices when you treat your patients. And this is completely different when you're using an FDA-approved drug or FDA-cleared device in an off-label application. So these are the definitions of what we're going to cover, the allogenic and regulatory status. It's important to understand the difference between 351 and 361 designations, and this is where minimal manipulation comes into play. We'll also talk about autologous products and then what is currently approved. So let's start out with allogenic. Allogenic basically describes any human cell or tissue that is harvested from a donor patient, and when you reapply it to a patient of the same species. So some examples are when you use like amniotic fluid or tissue. These don't contain any live cells. You're basically using a tissue matrix, whether it be for wound healing or other. If you use cord blood-derived mesenchymal cells, placental-derived cells, or exosomes. This is in contrast to autologous. Autologous is something that you take from someone, you harvest it from that patient and reapply it to the same patient at the point of care. One of the best examples of that is PRP. We take the patient's blood, we spin it down, we remove the platelets and the plasma, then use it, fat transfer, and also bone marrow transplant. So in 2017, the FDA published these guidelines on human tissue and cellular therapy. It's very long, and I think it's really nice. It's a good article to read. You can go to fda.gov and find it, but it basically talks about some of the guidelines on these newer therapies, especially as it comes to like stem cells and exosomes that we are hearing more about. So when you're determining whether an allogenic product is homologous tissue, which is this 361 registration, it's more straightforward, it fills out a form, versus the more intense 351 pathway. This is for a drug. This requires millions of dollars, 5 to 10 years of clinical trials. They must use and file an IND for an investigational drug, and the company must follow the minimal manipulation standard. So we're going to talk about the difference because one is treated like a drug versus the other is just registering a product. So homologous use tissue, which falls under this 361 registration, it means the repair, reconstruction, replacement of tissue that has the same function in the recipient as in the donor. So this is what it falls under. And then the 361 human tissue must be minimally manipulated. What that means is when they process it, it doesn't alter its original characteristics. So it has the same form essentially that it was doing in the donor. The labs that make these products have certain standards they have to meet. They have to be sterile. It's also important to note that there are no living cells in the product due to sterilization, but they're processed in a way in which the membrane is intact and still useful. These products act as a scaffold for your own living cells to use once they're introduced in the body. And you cannot make any claims about these products resulting beyond the function in their own tissue that it already performs. So these are some examples of currently available 361 minimally manipulated tissue in derm and plastic. So the AmnioFix is a chorion membrane. It's used in wound healing. Renuva is basically cadaveric fat cells. And once you use these products, it just creates a scaffolding of what your own body can build upon. So amniofix, it's this human amnion chorion membrane, and it's used for to reduce scar tissue formation, to help inflammation, and basically wound healing. But once again, no live cells. They go through this process where it basically protects the scaffolding and it leaves this intact collagen matrix. And you essentially get this matrix without any living cells. It is processed from human tissue, so it is it's under the American Association of Tissue Banks. So this is an example of a properly used 361 homologous product. Now, the 351 pathway, these are for products that don't meet the description of minimal manipulation. They're typically ones that are being cultured in a lab. They're mixed or processed in a way where you're altering its original form. The companies that use these products are required by the FDA to apply for an IND, which is an investigational new drug. And basically, this is a long, expensive pathway that takes many years. Any physicians using these products before FDA approval have to be part of the IND, and their patients must apply to participate in the experimental drug clinical trial, just as if you were using any other experimental drug, all of which are governed by an IRB. And it becomes a very expensive and risky way if you're going to do this before the FDA approves it. So, this is where many ethical questions come out if you're going to charge patients for some of these experimental procedures. So examples of these 351 products currently sold on the market, please keep in mind that the FDA considers these allogenic products unapproved drugs. So exosomes, whether they come from bone marrow or the placenta, any mesenchymal cell products, which are listed here, any amniotic fluid products containing, that claim to contain these mesenchymal stem cells. So it's really a wild, wild west situation. There's a lot of stuff out there. Many of them make various claims, but it's important to note that the FDA does not approve them. And in fact, as we're going to discuss, they can actually cause harm in some cases, which I'll share with you. So some of these companies will say, oh, these exosomes are 1,000 times more powerful than PRP. They can cure everything from your hair loss, pain, etc. Physicians have been charging a lot of money, thousands of dollars per injection. Companies are charging them a lot per vial with little to no proof of what's actually in them. Some of them just have saline and no live cells. They're claiming to their customers they can participate in their IRB or the IND, and they're on the verge of getting it. Some of them claim to have an FDA registered lab. However, the FDA kind of had issued a warning in their letter, and there's just a lot of marketing misdirection and a lot of tactics out there that can be very confusing. So in December of 2019, the FDA actually issued a warning regarding exosomes, and they wrote that there are no currently FDA-approved exosome products. Certain clinics across the country that violate stem cell products are offering exosome products to their patients that are very deceiving. And if you want to learn more about this, you can read the notice on FDA.gov. But there was also a very interesting podcast that's free called Bad Batch, where a physician and several patients actually got E. coli sepsis from using an exosome product. And when they tested the exosome product, they actually found that there were no live cells, but it was actually full of bacteria. So if you want to learn more about that, that's a free podcast called Bad Batch. But it's very important to know these are not FDA approved, and they can actually cause a lot of risk to your patients. So any patient or physician that's considering bringing on exosomes or using their treatment, you should ask if the FDA has reviewed the treatment and also what their IND number is. And remember, as a physician, if you want to use this, you also need to participate in the IND and use it as an IRB study. So also do your research. There are a lot of good blogs out there of physicians and scientists who explain the implications of practices going into using these allogenic exosomes and stem cells. So be wary with what you read, but there is some good data out there. It's also important to know that in that FDA letter, they actually stated that they're going to start enforcing against stem cell companies starting around November 2020. So a lot of this stuff has been going on, and the FDA is going to be cracking down in the next few months to regulate this use. It's important to know too, there was this TriTox scam in 2009. This is just an example of if you're using something before it's FDA approved of what can happen. There was someone using this TriTox that was sold in vials labeled as, for research purposes only. The CEO of the company said it was close to FDA approval and marketed it as a cheaper version of Botox. The physician who used it actually lost his license, lost everything, and actually went to prison. So be cautious of what you're using. So to summarize these allergenic classes, these are FDA regulated companies. They cannot regulate what you as a physician use, but keep in mind that if you decide to use these, the malpractice insurance won't cover any non-FDA cleared or approved products in case there's an adverse event like infection or sepsis, even if you have a consent form. There have been fraud cases brought against physicians that have been profiting the use of unapproved drugs or devices outside of the IND. There's a new stem cell ruling in Miami, which we'll discuss more about. And the FDA says if it's an unapproved 351 drug, using it as a 361, it will not protect its practice. So a lot of considerations. Other things to think about that, there are currently no exosome products that are currently FDA approved. We're going to talk about how this differs comparing to like PRP, which are autologous. It'll likely be at least 5 years before we see some legal exosome stem cell products on the market. They're going to be enforcing these pretty soon. So in the meantime, it's best to stick with your FDA approved or homologous use products only. So next, we're going to move on and talk about some autologous procedures like PRP. So what is the difference autologous versus allogenic? So autologous is harvested from that patient and then reapplied to the same patient at the point of care. So it's all their own product. Some examples of products we're using in aesthetics is PRP, fat transfer or nanofat, SVF, and then bone marrow transplant. So we'll go through each of these and kind of talk about some differences. So under PRP, there's actually several terms that it's important to be familiar with. So most of what we're going to talk about in the rest of our time is pure PRP, which means it has, your platelets suspended in plasma and very few leukocytes or white blood cells. There's also leukocyte-rich PRP. Some of the orthopedic double spin systems are going to have higher leukocytes. You have platelet-rich fibrin matrix, which basically has its PRP with some added calcium chloride, platelet-rich fibrin, PRF, and a lot of you have been hearing more about this lately. So basically, you don't add an anticoagulant during PRP, and you're left with this fibrin matrix. It's really good for wound healing or ulcers. You can basically use it on your wound bed. It does have a higher amount of inflammatory cells. So when you're looking more at wounds, platelet-rich fibrin is where you'll find some of that literature. Next is adipose-derived stem cells. So we'll talk about the difference between SVF, which is manipulated, and nanofat, which is not, and then bone marrow aspirate stem cells. So SVF, just briefly to cover, what is stromal vascular fraction? It's basically an extract made in the lab from fat. You use the fatty tissue and you actually separate it from the globs of fat, and then those cells are then concentrated to make SVF. So because there's an extraction process that uses an enzyme, usually collagenase, it actually changes or alters the nature of the product. So in 2017, the FDA stated that SVF does not meet the standard guideline of minimal manipulation. So to get around that, it is a drug, and these companies must get FDA approval if you want to use it. So this is where the FDA has been kind of winding down and taking action against some companies where patients went blind. So in order to get around that, people are actually, what's the way to use it? People are using to micronizing fat cells without separating the stem cells from collagenase, and that's where you get nanofat. Some of you may have heard of nanofat. You take the fat and basically pass it through a membrane, and then you're just left with, small particles of fat that have stem cells within them. So that is FDA approved, and it does follow that minimal manipulation pathway. Bone marrow aspirate stem cell concentrate. This is a part of your own bone marrow that has growth factors, anti-inflammatory proteins that have a lot of different healing functions. So this is when you take someone's own and then you use it basically in themselves. It is obviously invasive. So next, this comes to PRP, which, this is something I think is just a fantastic and phenomenal process. And it's where you use high concentration of platelets in a small volume of plasma. It's at least 2 to 3 times the concentration of whole blood. Now, PRP is just an umbrella term that does not describe characteristics of different systems, and we'll actually talk about some of the differences. PRP started initially in orthopedics and sports medicine, and then they used it in injuries and after surgery. And interestingly enough, the first PRP system, which which was class 2 FDA cleared, was in 1999. This device, or the orthopedic devices, got a high concentration of platelets, but they also had a high concentration of red blood cells and inflammatory cells. So, you needed a lot of blood. It was really painful because of the high amount of inflammatory cells. It was extremely uncomfortable. So, in surgical setting, orthopedic patients, it's not a big deal, but when you're doing it on patients who are awake for aesthetic procedures, that's where you're going to, people are going to be really uncomfortable. So as the field of regenerative medicine evolved, there's products that have a less inflammatory profile, more comfortable, easy to use system, less blood, same efficacy for aesthetics, and that's what we're going to talk about now. So where does FDA clearance and PRP kits stand? So all PRP products are considered class 2 medical devices by the FDA. So all products being sold for the purpose of collecting PRP must obtain the FDA class 2 clearance. So on-label clearance, PRP is intended for the preparation of autologous, meaning all from one person, PRP from a sample of blood, and then it's important to know that implications wishing to add PRP to their practice. So just be aware of some of the things we'll talk about. So, there's different systems on the market, and some of the PRP collection systems require adding an activator. And in this article, it says, clinicians are free to use a product off-label as long as they are well-informed, have scientific rationale, sound medical device. And in one of these articles, they actually stated that there was some concern over activated PRP. The FDA hasn't really clamped down on this, but clinicians using activated PRP should be mindful of some of these concerns. So, keep in mind when you're looking at different preparation systems, whether or not you use an activator, you might want to be cautious, just because we know later this year, the FDA is going to be clamping down on this, and there is some concern about adding an external activator. So looking at the PRP kits, are they all the same? And the answer is no. It is an umbrella term that does not allow for distinction between available products. And the reason is it doesn't take into account the platelet concentration and the presence of your inflammatory cells, which are red and white blood cells. So not all concentrates are equal. There are over 20 preparation systems available. And as of now, there's no standardization in dosing. And the lack of standardization for preparation makes it really difficult to correlate clinical results between studies. You'll read a lot of different things, but you really have to look closely and see what the concentration was of whole blood and the presence or absence of inflammatory cells. So when you are thinking of choosing a device, it's important to consider, what is the product FDA cleared, the manufacturer, who makes it, and where is it made? And we'll talk about why that's important. Is it a single spin, double spin system? And there is a paper that came out a few years ago called the DEPA classification that I'll share with you. You want to look at the, is there literature on it, looking at peer-reviewed journal, the safety or track record, the history of the device, how long has it been on the market, how many cases have been performed, any safety recalls, peer-reviewed published studies validating its use off-label, has it been working in the people and other physicians and then the patient experience. Ultimately you want to do what's best for your patients and give them good results. So these are all things to keep in mind when you're picking a system for your practice. This is just, an example of one of the single spin PRP systems that has, very low inflammatory cells, and yet you're medium to high platelet concentration. Other things to consider, the cost of the device. Do they provide quality of training? Like Revive is a great company, CME, they provide CME credit if you're going to have you and your staff trained. I know when I brought on the Eclipse system, about 5 years ago, their team came, they trained me, my staff, everything. And we have ongoing support from our rep because, say there's a problem with your kit or something happened, you want to make sure that you have someone there, because none of these kits are cheap. How easy it is to use. And then, do they provide marketing resources? So this is one of my favorite slides. It really just goes over the difference between the small volume single spin systems compared to your large volume double spin systems. These are all different FDA cleared PRP systems. So here we have, the biggest difference is your small volume single spin systems. You're going to get less inflammatory cells, which are your red and white blood cells. These are ideal for dermatology. And the hair, we know that even though most of us are using PRP for androgenetic alopecia, although it doesn't look inflammatory to the naked eye, we know under the microscope there are inflammatory cells. So we want to minimize that. Same thing with the skin. That also plays a role in your comfort of your patients. On the right here is our large volume double spin systems. These are more geared for orthopedics. So looking at our large tube separator systems, we're going to talk about some of the differences. You want to make sure, there's a third party that actually looks like at your platelet concentration, which is where these numbers came from. I'll share that Kushida study with you. And then you have your small tube separator. So these might be better when you're doing procedures with microneedling, like PRP with microneedling, or if you're injecting PRP in the face. But for the hair, I really think you need at least 2.5 to 3 times the concentration to get an effect. And then on the right here, these are the double spin systems. These you are going to have higher platelet concentrations, but remember, you will also have higher inflammatory cells. So keep that in mind. And you're also taking a lot more blood, anywhere from 60 to 150 mLs versus like your 20 mLs or less with your single spin. So the difference in final product also varies. So here we have our single spin gel separator system. So the gel actually pulls out your cells. And then right above the gel, you have your platelet suspended in plasma. So here is your PRP, and then your platelet poor plasma is here. So because there's no buffy coat, your platelets actually physically rest on top of the gel. The gel pulls out those inflammatory cells. You're limited to smaller blood draws, but it's much easier to use and more comfortable for your patients. Now, this is an example of your double spin system. So what you have is a buffy coat. So the buffy coat has your anticoagulated blood sample that contains most of your platelets. However, it also contains a lot of red and white blood cells also. And because you don't have a separator gel, your buffy coat, which has the highest concentration of platelets, also has the highest concentration of red blood cells. So the final product looks very different. So you can see your single spin system is nice and yellow compared to your double spin system, which is red. This is all your red blood cells, white blood cells, and that's why it's very acidic and it's very painful when you inject it. If you ask anyone that has ever received a treatment from these, all of them will almost always get a ring block in the scalp with lidocaine. So it's more pain, more discomfort. We also don't know how lidocaine interacts with our platelets. It's more time consuming for you. So, I think the easiest way to go is to use a small volume single spin system. I know I, as a dermatologist, don't feel comfortable taking 80 or 100 mLs of blood. What if your patient becomes hypotensive, something like that? Or a lot of my young female patients are, could be anemic, so we don't want to take more blood than we need to. And so single spin systems, and there's been a lot of literature supporting their use for hair restoration and also for skin rejuvenation. So this is a study. It was a independent study done by Kushida in 2014, and they actually looked at a comparison of your single and double spin PRP systems that were on the market then. So this is on Revive's website. I highly encourage you all to read the whole thing. But the biggest thing that we look at, and this is kind of comparing all the different systems. So they're all listed down here. Not all of them are available here. MyCells is actually the Eclipse system. So when we look at platelet-derived growth factor, this is one of the ones we know is crucial when we look at, the anagen or growth phase of the hair. You want to look at, areas or companies that had a higher level of platelet-derived growth factor. Same thing with TGF beta 1, that's transforming growth factor beta 1. Some of the companies that are single spin didn't have as high of amounts. The higher with that, the better. And then also VAGF, which is your vascular growth factor, which is stimulating more blood vessels to support the growth of hair. So this was an independent party that did it. And I think their study did a nice job just looking at the differences. So the DEPA classification, which I mentioned earlier, what does it mean? What does it stand for? So D stands for your dose of injected platelets. So, looking at your concentration of platelets in the whole blood versus what you get. The efficiency of production is your platelet yield divided by the percentage of platelets you recover. Your purity, this is looking at the presence or absence of red and white blood cells. And then activation, is it endogenous or exogenous? Exogenous, remember we talked about that neither calcium chloride nor calcium gluconate are FDA cleared for platelet activation. So I personally prefer an endogenous one that, gets activated. Actually, Dr. Bergfeld and I published a study on that, just looking at, the trauma of when the platelet leaves your needle, even a 30 gauge needle, that's enough trauma to activate it. So I don't believe you need an exogenous activator. And now after having done about 2,500 scalp PRP procedures, and with good efficacy, I really feel that to be true still. So looking at the different products on the market, so these are your PRP single spin systems, looking at their where they're manufactured, and, you know, their FDA clearance. So looking at the name of the company, the volume per tube, where they're manufactured, and, you know, looking at where they're manufactured. Some of these companies are all made in a certain area, and they get their tubes there. And I'll explain why. You know, there have been some issues with sterility in some of the tubes that have come out of China, where they actually found E. coli in some of the tubes. So it's important that you know where your products are being made, where they're coming from, and then obviously their FDA clearance. So also important to look at your economics of your separator gel-based systems. So if you look at the different companies that make these single spin systems and you actually look at the total platelet count and the price per tube, you can actually know your price per platelets. So, you know, looking at your total platelet count, you know, for like, for example, the Eclipse system, you're getting, it's like $4 to $5 per 100 million. Some of the others, you're going to pay actually more for your same, for less platelets. So important to know that, you know, when you're thinking about which system to incorporate, that there are differences, that not all single spin systems are the same. There are clearly differences that we're looking at, and it's important to know all of that. So as we talked about, it's also important to know the studies that are, you know, behind the company that you're using. So this was a study done by Amelia Hassauer and Derek Jones, that was published in Derm Surgery. And this was the Eclipse 22 ml kit. And they actually looked at a protocol for male and females with AGA. So they looked at different groups. One group got a monthly treatments for 3 months. The other were quarterly treatments. So they both overall did well. But the group that had monthly treatments had a almost 30% increase in hair density and a 31% increase in hair shaft thickness. The group that got quarterly treatments also had an increase in hair density and similar improvement in thickness. So the group that had monthly treatments did better. They also validated this subdermal injection technique, which has much less pain than an intradermal technique. The average patient had a pain level of 2 out of 10. This is with no anesthesia or lidocaine, which allows for a fewer total number of injections because you get diffusion. It's quicker treatment for you, for the patient, and less pain. Another study that was just presented at ASDS in 2019 with the Eclipse system from Mount Sinai. They looked at women, 28 women with AGA, and they did PRP versus placebo, and they found that at week 8 and week 24 that there was improvement in the hair caliber compared to the placebo group, and also improvement on photos. So I'm sure this will be published in the near future. And then this is one of many articles I've written on PRP. Myself and Dr. Bergfeld, who is actually a world-renowned expert in all types of hair loss, we wrote this article, and you know, this is what I was talking about before, that we believe when platelets are centrifuged, they become activated when injected into the scalp, which is why we don't use an activator. And then based on the published studies, that we believe a single spin centrifugation method with a mean platelet count of 3 to 6 fold of whole blood, and that minimizes the granulocyte. So you know, I use a subdermal technique. I don't activate it. I perform 3 monthly treatments followed by maintenance. And overall, I've had positive results in both men and women with all types of hair loss. And generally speaking, if you pick the right candidates, you're going to see good regrowth, improvement in density, and just overall improvement in their quality of life. So this is just a short demo on PRP that I filmed. Just in the sake of time, we're not going to watch the whole thing, but let's see if we can get this to play. So, you know, I think it's important to know that, you know, when you decide to bring on this to your practice, that you actually have the proper training. So know the company you're using, you know, make sure you, if there's a company that can give you support, like training, you know, if you can get CME, the company like Revive, they do hands-on, they do online. So, you know, you want to get CME training and then also have your staff trained. You know, it's really important that way, you know, you're doing things the right way. You're going to get the best patient results. So this is just a short clip of that. And like I said, just in the interest of time, we're not going to watch the whole thing. So, other things to consider regarding these PRP systems, there are some websites out there that actually sell PRP tubes that look very similar to current tubes on the market. You know, I don't know if you want to call it counterfeit or just identical. So they have, you know, some subtle differences of a lighter to cap and like a different font. And then some of the manufacturers actually, you know, you can see the difference in the packaging compared to what you can find online. So even though you might see there's a greater price difference, you're not getting, you know, the quality of product. These are some kits that are available to the public. You know, they're marketing them as these 22 ml tubes. They're obviously much cheaper than you get, but you're not going to get the same efficacy. In fact, most of these, if they are sterile, you're probably going to get platelet poor plasma, not platelet rich, because they're not manufactured to the same standards that the FDA requires. So, there have been some questions, and I get this asked often about what about using like your lab tubes, like your IVD tubes that are used and marketed as PRP. So it's important to know why we shouldn't do that. So these homemade PRP, when you use these tiger top tubes that are designed for lab work, they cannot be used as a medical device. They are not FDA cleared for reapplication to the point of care. So it's actually not legal to inject or apply them to patients. So they're meant to take blood and then, process it. It's not meant to reapply it back to the patient. Also, there's no way of knowing your platelet count or concentration. And you're going to lose more than half your platelets when you centrifuge them. So you'll probably end up with platelet poor plasma. Other safety considerations are that they can contain something called pyrogens, which are actually harmful for patients. So a pyrogen basically is something that induces fever, and it can vary and cause a lot of bad side effects to your patients. So just remember, these tiger top tubes are for in vitro diagnostics only. They are designated for the research of white blood cells, and they also contain Ficol, which is not safe to inject into the body. They also contain warnings listed on them, and they say, do not use tubes for collection of materials to be injected into patients. Precautions should be taken to prevent possible backflow from the tube during blood drawing. And then endotoxin is not controlled. Blood and blood components collected and processed are not intended for introduction back into the body. So just remember, you could actually cause danger, and it's not legal to use them for PRP. So other things to consider, well, people say, sterile versus pyrogen free, they're not the same thing. So sterile does not mean pyrogen free. The only manufacturing that takes into account pyrogen free are environments suitable for medical devices that are indicated for autologous procedures. So the IVD tubes are not held to the standard because they are actually not meant to be used as medical devices. So it's important to understand the difference. So sterility, just make sure that there's no viable bacteria. However, the act of sterilizing a contaminated vial can actually cause the release and deposit of pyrogens. So just know that they're different things, and just consider that, when you're picking your products. So, thinking about FDA clearance in the realm of PRP, know that there are several validated tests that are performed by third parties and agencies on these FDA cleared kits to ensure patient safety for autologous injection. So when I shared with you all the different PRP companies that were FDA cleared, they've all gone through this, which includes a delayed hypersensitivity test, a cytotoxicity test by elution, an acute systemic toxicity test. They also, the manufacturing of these kits must be certified. They undergo these audits and clean rooms that basically ensure sterility and safety. And these FDA cleared manufacturers must also have a quality system in place to make sure that their products are reproducible, and then any adverse events, defects, malfunctions are all tracked. So that's the biggest difference when you look at these FDA cleared products versus ones that aren't. So we'll just briefly talk a little bit about marketing claims and then this new Google ad policy and how it pertains to PRP. So using PRP, the FDA stance on PRP, they wrote this in the realm of sports medicine, but basically the clinicians have the responsibility to be well informed about the product, use it on firm scientific rationale and on sound medical evidence. And Google actually lumps off-label PRP therapies in unapproved allogenic stem cells. So right now, the PRP systems are class 2 FDA-approved medical devices. However, their FDA approval lies within the orthopedic realm and in the realm of joints. So when we're doing it for skin and hair, it is off-label, but like the FDA said, you're using sound medical literature, which every month we have a mounting body of literature using a PRP in the hair and the skin. So Google is actually, if you advertise PRP, you might find that Google ad policy will block it. So if you promote PRP on your website, Google bots will find it and probably take down your Google ads regardless of the content. So, what can you do? You might want to have like a separate dedicated website for PRP where you have like your own photos, marketing content, or you might want to remove and replace these keywords. So, if you have PRP or platelet-rich plasma, you might want to say like regenerative medicine or autologous therapy, just because Google's not going to pick it up and take it down. So that's something to consider also. Just a little bit about direct to consumer marketing in your office. So say now you've decided, I'm going to do PRP. I've picked my FDA cleared product. I've been trained, everything, I'm ready to go. What can you do to actually get patients? So, I'm going to have Kim kind of join on and talk about this because Revive does a really good job. We'll just briefly talk about this before we get to Q&A. And I really think that having a great, marketing package is really going to help you drive patients to your practice. And I know it's helped us tremendously. You'll also find a lot of my photos I've shared. Kim's team is taking care of the copyright, from the patient standpoint, the legal side. So these are all packages that are available to you guys, if you want them.
Yeah, we have. We've created the brochures, the banners, the video loops, anything where we feel like we want to take the guesswork out of it for our practices. We say everything in a compliant way. We have a legal copyright release from incredible before and afters from many of our faculty members. And so we're hoping that when you see the type of direct to consumer marketing brochures that we have, both for hair restoration, for microneedling, we're in the midst of creating it for shockwave therapy and erectile dysfunction, that you can come to us and we can create that for you. We've got video loops that you can play within your lobby that are powerful. We don't need to, show a lot of this, but we all know that a picture is worth, a million words. If you've got before and after photos that you can be playing, in your lobby for those patients that are waiting to meet with the providers, and they can show the efficacy of the treatments with microneedling, with hair injections, that goes a long way. Obviously, we ask that you always keep the provider's name on the photos in small print and to give them the recognition that they deserve. But with that legal copyright release, you can put them on your website, you can put them in your own brochures, you can buy our brochures, and we try to make it as easy as possible. We're actually going to send all of our registrants who actually showed up and attended the training a checklist of things that you can do to successfully launch PRP in your practice. All of the steps that it's going to take. And that's with or without our marketing materials. How are we going to throw a launch party? How are we going to get all of our best clients into our practice learning more about these treatments? How are we going to price this out? We've got some checklists for you. We're going to send those to you in our handout. It's basically called, launching PRP successfully. We'll send those all to you. And obviously, whomever your PRP resource is, check back with those reps, make sure that they're hosting and helping you with those launch parties, that they're helping you with suggested pricing. And they're a huge resource for you also.
Great. Thank you, Kim. So yeah, their team has done a great job, for the marketing material. So you guys can definitely look into that for PRP.
We just created this one. I love this package. This is for our microneedling. We love the models that we've chosen. The video loop is incredible. Your before and after photos that you've given copyright release to, not just for facial rejuvenation, but also for, scar revision, surgical scar, acne scarring. We've got before and afters on all of the banners, on all of the brochures. It's a beautiful marketing package. So we would love you guys to take a look at that. We've just barely launched those on our website. And we are ready. We're ready to ship those out and make sure that you've done kind of a makeover in your own practices on how to launch all of these procedures. And of course, with this webinar, we're giving 15% off of all of our marketing materials. We're giving 20% off on all of our CME online trainings. We've canceled all of our hands-on trainings nationally. We're in every city every month, and we've put those all on hold. And we've given significant discounts for our online CME trainings, and then obviously for all of our marketing materials.
Great. Thank you. So a
Sure.
lot of times I get asked to, well, now that I have PRP in my practice, like what can I do to get patients or like drive patients there? So just to give you an example, when I was starting PRP, I reached out to my local Fox 8. I said, hey, this is a new treatment I'm doing. And, depending on where you are and what your relationship is, they may or may not charge you. They came out, they did a segment that aired that day, and I can't even count the number of patients that drove to my practice in the beginning. So since then we've done pieces here and there, but I highly recommend this for those of you that are starting it in your practice, just to get the word out there and to let people know it's available. So, in summary, a few things that you want to consider when you're talking about compliance for your PRP practice. Your malpractice insurance really wants these questions answered that, have you and your staff been trained? Do you have the appropriate consent forms? And I should add too, on some of the Revive trainings, I've actually shared many of my consent forms that I've worked with our legal team at Cleveland Clinic. I have my before and after instructions, my consent forms, all of those. So make sure you have a consent form for the different procedures you're doing. And then also, are the kits you're using FDA cleared? And then if the FDA cleared kit you're using for the off-label application supported by peer-reviewed scientific literature to which you can point patients. So, I use the Eclipse system. I can pull at least a dozen or more peer-reviewed literature studies supporting its use. And then, are you using PRP in a way that the FDA considers minimal manipulation, meaning nothing added that alters the platelets, which even includes your activators like calcium chloride, calcium gluconate. So keep all of that in mind moving forward, because the FDA is going to be becoming more strict on this, and we want to make sure we're in compliance and doing what's best for our patients. So in summary, with the different preparation systems, you only want to use FDA cleared kits. Make sure your kit is supported by published studies. Know your DEPA characteristics, follow proven protocols, and make sure you get proper training before starting. So with that, there are different courses that Revive offers. I've done many of them on the PRP, hair restoration, facial rejuvenation. They have them on, sexual health and facial rejuvenation and all sorts of different things. So as a thank you to you guys, are offering a discount. So thank you, Kim, and your team. Thank you all very much. I hope everyone stays safe and healthy. I appreciate you guys taking the time out of your evening to spend time with me. This is a great topic, and thank you to the Revive team for your support and for doing such a great job hosting us all this evening.
And again, we thank you so much for being with us, and good night.